I'll be presenting on optic nerve hypoplasia, severity of disc hypoplasia and its association with vision and neuroradiological findings. Optic nerve hypoplasia is a common congenital disc anomaly and is a leading cause of childhood blindness. It is a non-progressive underdevelopment of optic nerve accounting for profound vision loss. It has a wide clinical spectrum of symptoms ranging from vision impairment from neurological to endocrinological abnormalities. If we consider association, it has divided into ocular and neurological. In ocular, it ranges from microphthalmos to nystagmus and strabismus, while in neurological, it can be developmental delays, seizures, agenesis of septum pellucidum, and Demosius syndrome. The objective of this study was to understand the association of severity of optic nerve hypoplasia with ocular and radiological findings, and to also decide the characteristics between unilateral and bilateral optic nerve hypoplasia. It is a retrospective observational case series conducted from January 2015 to December 2023. We screened folders with ICD code of optic nerve hypoplasia, among which we got 297 folders. In this, 57 patients were included for final analysis with the records of optic disc photographs were available and neuroimaging findings were present. Optic nerve hypoplasia per se is divided into clinically as diffuse, segmental and segmental with tilt. We included patients with diffuse optic nerve hypoplasia. The data was collected in demographics like age, gender, presenting complaints and systemic comorbidities, while for the correlative analysis, we took into account logMAR visual impairment, optic nerve head assessment with photographs in terms of size, double ring sign, peripapillary changes, abnormal blood vessels, and disc diameter to disc to macular distance, as well as neuroimaging findings in all patients who were included. Optic disc assessment was done by a single observer with optic disc photographs in undilated state. The disc was measured both vertically as well as horizontally, and average was taken, and the disc to macular distance was measured from the temporal margin of the disc to the center of the macula. And based on that, the disc macular distance was calculated in terms of ratio. Like in photographs, you are seeing here that from left to right, the severity of the disc hypoplasia is increasing. Neuroimaging findings were also noted in patients. The results were analyzed with the help of STATA software. Mid, median, and mode was included for qualitative analysis. Quantitative and qualitative analysis, we did multivariate regression analysis. P-value less than 0.05 was considered as statistically significant. Mean age in this study was 11.38. There was no statistical significant preponderance for gender. We had more patients with unilateral optic nerve hypoplasia. Strabismus was noted in 87.71%, and the exotropia was more common noted. Most common presenting complaint was blurring of vision, followed by others like nystagmus, loss of vision, and strabismus. When we divided patients based on WHO classification for vision impairment, we saw that we did analysis for right eye, left eye, and the best corrected visual acuity for that patient. And there was a varied range of visual impairment in these patients. When we compared vision impairment compared to bilateral versus unilateral, we saw that most of the patients with bilateral optic nerve hypoplasia had some amount of vision impairment, and more so in bilateral group for profound and severe vision loss. Refractive error assessment had more of myopic refractive error, and it was ranging from mild hyperopia to significant high myopia in these patients. When we did optic nerve assessment in terms of size, we noted that most of the patients had small disc size, and average and large disc size was noted in patients with unilateral optic nerve hypoplasia in the unaffected eye. Abnormal blood vessels like tortuosity of blood vessels and trifurcations of the blood vessels were noted in both the eyes. Double ring sign was noted in most of the patients, and left eye was more commonly involved because in unilateral optic nerve hypoplasia we saw that left eye was more commonly involved. When we graded the patient between mild, moderate and severe optic nerve hypoplasia, we found that most of the patients were in the range of 3 to 5 distance to disc macular distance. When we graded patients and tried to do the correlation analysis based on vision impairment, like in this graph, you can see that x-axis is showing vision loss, mild, moderate, severe and profound, while on the y-axis we have graded the optic nerve hypoplasia based on mild, moderate and severe and profound optic nerve hypoplasia. We can see that x-axis is showing there is a significant deterioration in the vision loss in bilateral optic nerve hypoplasia. Same thing was happening with bilateral as well, where the common finding in imaging was noted as chiasmal optic atrophy and absent septum pellucidum. Multi-regrade analysis showed that there was a significant relation between the disc distance and midline anomalies with severe vision loss. The strength of the study was single observer, and it was a retrospective was a main limitation of the study. We found that unilateral optic nerve hypoplasia was more common. Severity of optic nerve hypoplasia was a surrogate indicator for neurological abnormalities, and bilateral optic nerve hypoplasia is known to have more neuroradiological manifestations compared to unilateral one. Thank you.
Which type of neurological
Yes, ma'am.
symptom did you find in unilateral and bilateral?
I didn't get your question, ma'am.
So you were saying, no, initially when you did the logistic regression analysis,
Yes, ma'am.
what was your results basically?
So logistic regression analysis, we divided the patient into mild to severe and compared with,
So
yes.
what are the grades you have compared it? So only the optic disc head or anything else you have taken into account? With the severity, visual assessment you have done, no?
Correct, ma'am.
Doing it with the grade of the optic disc.
Yes, hypoplasia, yes.
Anything else? Did you look at the age or anything which is correlated when we are doing a multiple regression analysis? Certain factors are there. So what
Correct.
are the predictive risk factors in this
The
case
most common predictive risk factors in these patients was the increased disc distance to distal macula. Like severity of optic nerve hypoplasia was, the more severe it was, the vision loss was poor. Along with that, the patient who had midline anomalies, they had a poor visual impairment, like poor vision in the given set of patients. Age was not kind of related, man, because it was ranged from
okay, what are the radiological findings did you find? Which type of neurological?
it ranged from, most common was absent septum pellucidum seen in 30% of the patient, followed by chiasmal optic atrophy and T2 hyperintensities, which were noted, abnormal hyperintensities.
So, did you take any other visual parameters like contrast sensitivity or other things that you might
We had checked, ma'am, especially color vision and relative afferent pupillary defect also had checked. It was not included here. But yes, we saw that these all patients, some of them had developmental delay also. So they had other associated visual abnormalities as well.
other ocular findings? that
We had strabismus in most of the patients. Nystagmus was present in almost 80% of the patient. We had few patients with Brown syndromes and MED also in this situation. 2 patients had microphthalmus and 1 patient was had aniridia. Even endocrinological analysis was also taken into account, and 8 patients had endocrinological assessment done. Among them, 2 had growth hormone deficiency, 1 had testosterone low levels, and 1 had growth hormone deficiency.
Okay. I would I would just congratulate you for the excellent presentation.
Thank you,
I
ma'am.
just wanted to know whether there was there any connection between in your series you said that exotropia, exophoria was more common.
Yes, ma'am.
So was it anywhere related to the loss of vision? Because I mean exotropia, exophoria is a position of rest.
Yes, ma'am.
So was it anywhere related to loss of vision?
Yes, ma'am. Most of the patients who had exotropia had poor vision. So that's how it was related.
Very good. Wonderful. Can we call the next speaker, please?
Thank you.